This video is looking at peripheral neuropathy and massage. The starting point for discussing massage and peripheral neuropathy is that it's a long-term commitment to treatment. Treatments need to be frequent and over a lengthy period of time to be effective. Massage will not cure peripheral neuropathy, but it can help in maintaining the health of the affected area. Peripheral neuropathy refers to damage to the peripheral nervous system, and it includes the motor nerves used by the brain to control muscles. It also regulates the automatic functions of the body, including blood pressure, sweating and bladder function, along with the sensory nerves which pass sensations, including pain signals, to the brain. Peripheral neuropathy often affects the hands, the feet and the lower legs. The longer a nerve is, the more vulnerable it is to injury. It's vital that treatment for peripheral neuropathy is carried out in conjunction with other appropriate medical treatment through the client's doctor or specialist. Always be gentle in your massage. You can't risk bruising or damaging an area where there's limited or no nerve sensation, and your client won't be able to give you feedback on depth, so err on the side of caution. When it comes to treatments, we begin by looking at the feet. Reduced sensation in the feet from the condition may mean that the client's not aware of cuts or blisters that could go on to become ulcers. A person with peripheral neuropathy is also more prone to athlete's foot and fungal nail infections. If that's a problem, consider wearing disposable gloves to give the treatment, because some of these things can be highly contagious. So the footwork here is a little different to usual, so that's what we'll focus on with our work with a client. I'll also explain the work here so that you can see what the overall treatment is before I demonstrate it. Use plenty of oil so that you don't drag the skin. Start at the toes, stroke up the bottom, side and top of the feet, around the ankles, up to the leg and the knee on all sides. After you've covered the whole foot and lower legs, go back to the toes and work in all these areas, but stroking a little deeper. Use the palm and the heel of your hand to apply moderate pressure to the feet, supporting the opposite side of the foot with the other hand. Use small kneading movements on the foot to apply this pressure, starting at the toes and working all the way around the foot, moving just 2 to 3 centimeters at a time. Be careful as you knead the top of the foot not to put too much pressure on the delicate bones. As you move up the legs, use longer strokes so that you're kneading upwards 10 to 12 centimeters at a time. Taking the foot in both hands with your fingers on the sole, gently squeeze the foot, working from the toes to the heel. Get feedback from your client as to how hard to squeeze. It can be an unexpectedly pleasant move for the receiver, and you'll be able to work more deeply than you think. The last deep but gentle move is to form a fist with one hand with the thumb tucked in and use the knuckles to work the sole of the foot. Start where the toes join the foot and draw semicircles with your knuckles along the foot, working in lines across the foot, working backwards to the heel and ensuring you also cover the sides of the foot. Don't work the top of the foot with your knuckles. This move might be more tender to begin with, so only work to your client's tolerance and err on the side of caution if somebody's got that decreased sensation in the foot. But aim to build depth with subsequent treatments, remembering that the aim is to improve the circulation in the foot. The final part of the treatment is to return to the long strokes that you started with, from toe to just below the knee. If they can, your client should sit with their feet raised on a small footstool for the next 20 to 30 minutes. Treat both feet and then you can carry on up the leg for the rest of the full massage treatment if you wish. If you're leaving it here and just specifically treating the feet and legs, just follow up with some effleurage up the rest of the leg to the top. So when we come to the practical work on peripheral neuropathy, we're remembering that we're working on the foot here, assuming that this is where the damage is. We're checking, first of all, that there's no cuts, there's no sores, there's nothing that needs attention that because of the peripheral neuropathy, Gordon might not be able to feel. We're then doing just feather-light strokes to begin with. What we're trying to do here is we're just encouraging that lymphatic movement, and we're encouraging the top layers of the foot structures to start moving. We're working very gently to begin with, because remember there's reduced sensation here, so we don't want to work too deep. And to begin with, we need to just let the foot know that we're here and get things moving. We're doing the same across the ankle. It's all very feather light, and then we're going up the calf towards the knee. I'm just going to show you with one hand just so my other arm isn't blocking the shot. But it is just feather-light strokes. You can use the back of your hand, you can use the front of your hand. But the main emphasis is this is light work. We're just encouraging that movement of fluid. We're then going to squeeze the foot, starting all the way at the toes and coming all the way down to the heel. This may seem a bit strange, but it should feel actually really nice. As we go, we're gradually increasing our depth. Remember, one of the aims of this treatment is to start increasing circulation. So where we started with a more effleurage treatment, just working the top layers of the structure, we're now working a little bit deeper. You can also roll the foot. Again, just be careful. If there's any broken skin or anything like that, then you're avoiding this work. So you can go between the rolling and the squeezing. We're then going to come back to the foot, and that warm-up work that we did, we're now going to repeat but a little bit deeper. So initially we were just moving the surface structures. You can see as I'm working there, I'm starting to move the bones. You can see the toes moving. So we're moving the deeper structures of the foot. Now, if somebody has plantar fasciitis, stop here, because you don't want to be pressing into here. There's a separate video on that, but just as a contraindication, don't press into here because it will be very sore. We can repeat that footwork over and over again. You can also come up the side of the foot. And you can see I'm kind of almost pulling the muscle against itself. And you can work up the inside. Just be a little more gentle in the inside because the calf, the arch is a bit more of a delicate structure. And you can carry on that work up the leg as well. So it's that effleurage, but working deeper so that we're getting more movement in there, all the way up into the, to behind the, just before behind the knee again. And we're then going to do, using the flat of your fist or the flat of your knuckles, so support the foot. You can see I'm resting the foot on my hand, and my hand is resting on my own knee, so that I've got that support there. And you're making little circles. So I'm making contact with the skin, and then I'm circling. So I'm not moving my circle across the skin, I'm moving the skin. So if I did it with my thumb, you'd see I press in and I'm moving the skin, which is different from moving across the surface of it. So by holding it in place and then moving it, I'm working these deeper structures. Now again, for somebody with peripheral neuropathy, they may not be able to give you a full depth gauge. So practice on friends, practice on family first till you're really confident about the depth that you're working to. It could be that the peripheral neuropathy only affects one leg, and then you can get a gauge from the other leg and work from that. You can get that when somebody's maybe had a calf injury or a knee injury, where the neuropathy only affects one limb. Often with things like diabetes, it will affect both. So you can see I'm working up from toes to heel. When I get to the heel, I'm coming back down and I'm repeating right from the toes. I'm never working down from heel to toe. I'm always working from toe to heel. And that's just any work that you're doing at depth, you should always be working towards the heart. You can do that foot squeeze again. But in all of this, you're just gradually picking up your depth, but only to a moderate depth because of that lack of sensation. The aim in this is we want to get more blood flowing here because that's going to help preserve the tissue. It's going to help them preserve mobility, which will help with things like falls, help to prevent falls. And make sure you're using lots of oil because the skin here is likely to be dry. You need to make sure you've got plenty of oil on. If your client's already using some kind of moisturiser, perhaps a prescribed moisturiser, on their foot, you can use that for your massage. What you're looking for is to make sure that you're not dragging the skin. You don't want to compromise, you don't want to be responsible for any cuts on the skin. So use your own oil, use their moisturiser, but just use plenty of it. If you need to break off so you can go and wash your hands before you then move up to the leg, that's fine. And that's how we would work with this peripheral neuropathy to try and get that movement, to try and get the fluidity in the muscle and trying to encourage circulation. Peripheral neuropathy can also be experienced in the hands. To treat this, you follow the hand massage protocol, but work extra gently, especially along the fingers and on the back of the hand. Usually use a little massage oil or cream on the back of the hand to prevent you dragging the client's skin when you work.
If you liked this video and you want to see more, make sure to subscribe below and don't forget to hit the notification button.